Good afternoon. My name is Jay Davis with Brand New Day, and thank you for joining us this afternoon. We think you will enjoy our speaker, Dr. Wayne Dysinger, on the topic today on reverse your diabetes and lower your risk for COVID-19. We have on our program the ability for you to submit anonymous questions, and on your screen you will see on the right-hand side a chat box, and if you click on Q&A and type in your question, we will attempt to address it today. Our speaker today is Dr. Wayne Dysinger. Dr. Dysinger is a board-certified family medicine physician and who trained at Loma Linda University. His practice is Lifestyle Medical Solutions, and he is the founder of the practice with offices both in Riverside and Redlands, California. Dr. Dysinger and his associates are participants in Brand New Day, and Brand New Day is a Medicare Advantage health plan. In addition to having a program that offers benefits to individuals who are eligible for Medicare, we also offer a program that specializes in taking care of individuals with diabetes, and programs to support our medical providers like Dr. Dysinger and our members. And with that, it's my pleasure to introduce Dr. Wayne Dysinger to present the program today. Thank you.
Thank you, Jay, and thank you to Brand New Day. You know, we've worked with Brand New Day for almost 5 years now, and we're very grateful for their ability to be innovative, for their ability to understand the big picture, to understand the opportunities to do things like put diabetes in reversal or remission, and to give us the flexibility that we need to really apply the programs that we have to help people be successful in those areas. So we're talking about diabetes today, and we're talking about diabetes because it's one of the more common chronic diseases, and it's one of the things that we know we can reverse or put in remission. One of the questions that we've had is, do we use the word reversal or do we use the word remission? Reversal, everyone understands what reverse is. That means you sort of get rid of it. You back it down and you sort of get rid of it. Remission is more of a clinical term that is used in cancer and other things. So most doctors probably like the term remission more than reversal, because we know that when we get rid of diabetes in someone, it can come back at a moment's notice unless they continue to do the things that they started doing to put it in remission in the first place. So we've used both words, reversal and remission. You'll find remission a little bit more in this slide set. But we also know that reversing diabetes decreases your risk for COVID-19. And there's a lot of things about COVID-19 that we have very little control over. But if we can use any resources that we have to reverse our chronic diseases or to put them in remission, then that's a very valuable thing. So this is a slide just talking about diabetes. And you can see this slide is really looking for the last 20 years and how diabetes has been increasing. You can see back around 2000, it was total diabetes was around 8%. And now it's closer to 12 or 13%. If you kept this graph going, before, so if you took it back to say 1950 or 1960, it was about 1%. So we've gone from over the last 6 or 7 decades, we've gone from a diabetes rate of close to 1% to a diabetes rate of close to 13%. And that's just diabetes. There's also prediabetes as a separate diagnosis. And the estimate is there's about close to 3 times the number of people with prediabetes as there are with diabetes. So if you look at everybody in the US, close to half of them have either prediabetes or diabetes. And again, 5 or 6 decades ago, it was 1%. So a dramatic increase. And we're going to talk in a little bit about why that is. So one of the things that's become clear over just really the last 5 to 10 years is that diabetes actually can be put into remission. So this is data from a study done in England. And in this particular slide, you can see if you've had diabetes for a short period of time, there's better chances than not that you can put your diabetes in remission. So you can actually get your blood sugars normal, get your hemoglobin A1C normal, and not be on any medications, not be on insulin, you can literally get rid of your diabetes if you catch it early and if you do the right things. And you can see the longer you've had the diabetes, the harder it is to get into remission. It's like anything where there's ongoing trauma, it's harder to overcome that trauma. It's harder to heal from it. But if you catch it early, you can generally get into remission of some type. These people in England have since done another study where they show the real correlation between weight loss and diabetes remission. So people who lose a lot of weight have even a higher percent in remission. So if you have diabetes and you're overweight, if you can lose weight, you have close to 100% chance of getting your diabetes in remission. So they go together well, or you could say they go together poorly as well. But so this is slide. These are graphs that I showed in our presentation a couple months ago, where we were talking about protecting ourselves from COVID-19. And this is data on the left-hand side is from China, and the right-hand side is from Italy. But both of them are saying more or less the same thing. The first one is saying that people with heart disease had a 10% chance of dying with diabetes. People who had no chronic disease had a 0.9% chance of dying from diabetes. And you can see in between, dying from COVID-19. And you can see in between diabetes, chronic respiratory failures, high blood pressure, all of these chronic diseases increased the rate of death significantly. On the right-hand side, the data from Italy is showing if you had 3 or more of these, you had a 50% chance. This was a little different, but close to 50% chance of dying, versus if you had no chronic diseases, very little chance of dying. So if you have chronic disease, it can literally be a life and death matter, not just from the chronic disease, but also from this virus that's haunting our country and our world right now. So we showed the data on reversing diabetes or putting it into remission. So how do we do that? How do we get diabetes into remission? And it involves a lot of things, but much of it is directly diet related. So what we eat affects our diabetes dramatically. In fact, I like to say diabetes is a food-borne illness. Most doctors won't tell you that, they won't say that, but the data seems to show that diabetes is actually a food-borne illness. You get it because of how you eat, and you put it into remission by eating differently. So what foods should we stay away from? Now, most people understand that when you have diabetes, you need to stay away from sugar. So diabetes is when your sugar is high. It makes a lot of sense that you wouldn't put extra sugar in your body because that would make your sugar even higher. So most people understand that, and most diabetics at least try a little bit to limit sugar in their diets. What people don't understand as well is the other things that can cause diabetes. And I've highlighted 2 others here in this graph. There's several others or subcategories of these. But the second one to talk about is processed flours. So there's this thing called the glycemic index. The glycemic index measures how fast our blood sugars go up after we eat a food. And we know that sugar pushes that blood sugar up really quick, but we also know that flour, especially a processed flour like a white flour, so that's the classic for pushing up that blood sugar real quick, is a high processed white flour type of food. So that can be bread, it can be pasta, it can be certain cereals, it can be things like cookies and cakes, you know, above and beyond, even things like bagels, where there may not be the sugar load. Some of those things have high sugar loads as well, but even if you don't have that high sugar load, that flour is assimilated by the body very quickly, has a high glycemic index, and eating a lot of that will make your diabetes worse as well. So then the third thing, which is what's probably least known by the average diabetic or the average American, is that fats also make a huge difference as far as diabetes. In fact, there are some people that think of these three things, that fat is the most important component for how we get diabetes and how we reverse diabetes. Processed fats, when you think of the word processed fats, generally you're thinking of oils, but it can also be these trans fats. Now, luckily here in the US, most of the trans fats are now being taken out of our food supply, but those were definitely harmful. Saturated fats, those can definitely increase the chances of diabetes. And for people who don't understand saturated fats, I'll just say one word, and that word is cheese. Cheese is by far the biggest source of saturated fat in the average American's diet. So eating that cheese, if you have diabetes, that's making your diabetes worse. If you're worried about getting diabetes, eating cheese increases your risk for diabetes. So these are the three things that we need to stay away from: sugars, flours, and processed fats. And when we do our diabetes reversal programs, we try to limit or eliminate these things from people's diets completely. So how about foods that we should eat? So the one thing that we know that helps with diabetes, the one food that we know that helps with diabetes, or the food component that helps with diabetes, is fiber. So getting a lot of fiber into our diet decreases our blood sugar. It sort of flattens. We talked about the flour and the sugar pushing up the blood sugar really rapidly. Fiber really settles that. It flattens the curve. It makes it so your blood sugar doesn't go up quickly. And so it's good to understand fiber, to understand where fiber comes from, and understand how to incorporate that into our diet on a regular basis. Fiber is a type of carbohydrate, but it's a complex carbohydrate. It has this low glycemic index, so it's actually good for us. The carbohydrates that we don't want are these simple carbohydrates. So sugar and flour, those are simple carbohydrates. Those are the ones that we want to stay away from. But the complex carbohydrates that have a lot of fiber in them, those ones are actually good for us. And so where are those found? The highest amounts of fiber are found in legumes, the beans, the lentils, the garbanzos. So we're huge fans of legumes. In fact, I tell people on my tombstone, it's going to say, "He ate beans for breakfast." That's what I'm known for, is pushing beans, and pushing beans even for breakfast. It's nice to have a high protein, high fiber food early in the day. And beans are not only great in fiber, they're also great in protein. So they're in my mind, the best source of protein. So we also push vegetables. Vegetables are great sources of fiber, and they're in most every vegetable. The ones that we've listed here: eggplant, okra, sweet potatoes, those are some of the higher fiber vegetables. But in any vegetable is going to give you some good amount of fiber. Same with fruits. Pretty much any fruit is going to give you a good amount of fiber. But again, the ones listed here: figs, pears, raspberries, those are some of your higher fiber fruits. But again, any bean is good, any vegetable is good, any fruit is good. A lot of people worry about fruits because fruits are high in sugar, but they're not high in processed sugar. So again, before the word sugar here, we have processed. The sugar in fruits are natural sugar. And because there's a lot of fiber in those fruits, you don't tend to have the high glycemic index. Just a couple caveats there. If you're not eating the skin of the fruit, so melons is your classic example, especially watermelons, that does have a high glycemic index, so you have to be a little careful with those fruits. If you're diabetic, that also happens some with tropical fruits, so things like pineapples or mangoes. You tend to not eat the skin, and the glycemic index tends to be a little higher. So a little caution with those types of fruits, but otherwise, fruits are fine if you're eating the skin. The only fruit where you don't need to eat the skin is citrus fruits. You're fine. They still have plenty of fiber in them, even when you don't eat the skin. But otherwise, if you're eating the skin of the fruit, it's fine. If you're diabetic, you don't need to limit the amount of fruit you eat, as long as you're eating the skin. And then the final category for fiber is the grains. And a lot of people, when they think about fiber, that's the first thing they think about. Oh, you get fiber from grains. But it's actually, in our list, it's the fourth thing to think about, because so much grain is processed. And again, our enemy, to some extent, is processed. It's the processed sugars, the processed flours. And so many grains are turned into processed flours. But there are ways that you can eat whole grains. So brown rice is considered a whole grain. Quinoa is considered a whole grain. Steel cut oats or rolled oats, those are not quite whole grains, but they're close enough that those are going to be good sources of fiber and a good component of your diet if you're a diabetic. So this is the core. If you want to reverse your diabetes, if you want to put your diabetes in remission, you need to have the processed sugars, the processed flours, and the processed fats very low or eliminated from your diet. And you need to have the high fiber foods, the legumes, vegetables, fruits, and whole grains very high in your diet. So I'm going to tell a couple stories here. So these are real life stories of patients that are in my practice. And I've changed, obviously we've not used names, and this is actually the real picture of this patient. So he was a 73-year-old gentleman. He came to my practice. He'd already lost some weight when he came to my practice. He used to be 330 pounds, and he's relatively tall. He's about 6'2", but still 330 pounds was way overweight. His ideal weight was closer to 200 pounds, 190 to 200 pounds. He had a little bit of diabetes. His diabetes wasn't terrible, but he definitely had that. He had some arthritis, but then he had this condition on his leg, this skin condition. And that skin condition was really what bothered him. He wasn't able to walk much. And he was getting ready to go on a cruise. And he said, this was last year. It wasn't this year. So obviously in 2020, we don't go on cruises anymore, unfortunately. But in 2019, he was getting ready to go on a cruise. And he said, when I go on the cruise, we're going to dock. And I want to be able to walk off the ship and walk around the town some when we dock. I want to be able to enjoy my cruise and not have my walking limit me. And he said, I've had this issue with my leg for years now. He actually had a spider bite that affected his circulation some. And he'd been to doctors all around the country, and basically they were saying, your leg's just going to keep getting worse. There's not really anything you can do about it. So just keep, just enjoy life as much as you can. So this gentleman came to my practice, and I said, well, I don't know what I can do about your leg. I can't promise you that we're going to change your leg, but I think you should try what we're doing. I know we can help you lose some weight. I know we can help you reverse your diabetes, probably help you with your arthritis. But I don't know what we can do about your leg. And he said, well, I'm all in. I'm going to just jump in. So he went on what we call a whole food plant-based diet. And basically for him, he took it very aggressively. So he said, I'm going to be vegan, which meant he wasn't going to eat any animal products whatsoever. So no meat whatsoever, no dairy whatsoever. He wanted to go all the way in, which not everyone has to do, but he chose to do that. And I was 100% supportive of him doing that. And he also, we do some other things in our practice. We don't just talk about what you eat. We also talk about how you eat. So he did some sort of short fast with us and some other things around how you eat. And he sort of joined all the kinds of things that we do in our practice. So we have a lot of groups, and he joined the groups regularly. We have cooking classes. He'd come to our cooking classes, and he just went all in. Now, he was married. His wife went all in too. So his wife was very supportive of what he was doing. He kept losing weight. So in 4 months, he lost 43 pounds. His latest weight is an ideal weight for him. So I said he used to be 330. He's now about, in the high 190s, 190 or so, which is ideal weight. And when he came to me, he was in the 230, 240 range. So as he did this, his diabetes totally disappeared. So his hemoglobin A1C was not that high to begin with, but it went down to 5.4 on no medications whatsoever. So it totally normalized his diabetes. But what's amazing to me is his leg got better. So these are literal pictures of his leg over the course of several months. So you can see the first picture there, what his leg looked like when he first came to our practice. The second picture was clearly improving. The third picture, it was close to a normal leg. But what's even more amazing, the slide's not in here. What's even more amazing is not only was he able to walk around on that cruise. So when the cruise was about 5 months after he started in our practice. And not only was he able to go on the cruise and walk around on the cruise, go down to the towns and see the sights, but he also started playing Frisbee golf. So he was literally walking around golf courses, playing Frisbee golf. His legs were so much better and he felt so much better. So he'd really given himself a new life. And it was because he took on these tools that we know can reverse diabetes and in fact reverse a variety of chronic diseases. You saw in him, it reversed his obesity, reversed his diabetes, and changed his skin. And he doesn't have near the arthritis issues now that he used to have either. So how did he do that? Again, he did it to a large extent with diet, but it's not just diet that matters as far as reversing diabetes. So in our practice, we have four pillars in our practice that we use to help put chronic disease in remission. One of those pillars is nutrition. So we already spent time talking about nutrition and some of the things that we do from a nutrition perspective. Another one of those pillars is exercise. So we believe that exercise matters, and the previous gentleman exercised regularly. Again, Frisbee golf became one of his exercises. The third pillar in our practice is what we call resilience. Resilience is how we manage sleep and stress. So sleep and stress tend to go together. So if you're having a hard time sleeping frequently, if you manage your stress a little differently, add a few more stress management tools in, your sleep will get better. So that's another chronic disease. The insomnia is another chronic disease that actually responds to changes in diet and changes in exercise and changes in resilience. And then the final pillar, so nutrition, movement, resilience. The final pillar is what we call connectedness. So connectedness means your social network, as well as what we talk about is vertical connectedness, your spirituality, your purpose, your meaning in life, and how you balance yourself in that aspect as well. So we work on all of those things with our patients, and we have a lot of groups. We have a lot of resources that really helps people get back to this balance in life, allows their body to heal, and really allows for these diseases to go into remission. So another story, and then we'll be wrapping up after this story and have time for questions and answers. I see some good questions coming in, so please keep your questions coming in. So this story is about a lady. She was also 72 years old. And she came to us with diabetes that was very poorly controlled. In fact, you can see there her initial hemoglobin A1C was 13.1. And for those of you not familiar with hemoglobin A1C, normal is 5.6 or less. Pre-diabetes is 5.7 to 6.4. Diabetes is 6.5 or higher. And for our diabetic patients, we like to get them all we like to get them less than 7. So for her to be at 13, she was double what we wanted her to be at. And then she was overweight as well. This isn't her actual picture. This is just a stock picture, but it's the kind of patient that we have. So she also had some issues with her kidneys and with her blood pressure, and she'd had a small stroke. So we put her in our programs. Again, we used all 4 of our pillars: the nutrition, the movement, the resilience. She started coming to our groups, and we saw very rapid changes in her. Actually, she didn't want to be on medications. Occasionally, you know, especially if someone comes in with a hemoglobin A1C that high, we'll put them on medications. But she didn't want to be on medications, so she just did the things that we do in our practice. And you can see what happened to her hemoglobin A1C. It went from 13.1 down to 6.6 in just a very short period of time. This was actually over 4 months, and that was without any medications whatsoever. So she literally put her diabetes in remission with no medications, just with diet, exercise, all the 4 pillars that we use. But nutrition is the most important. Again, diabetes is a foodborne illness. And she got these dramatic results. The interesting thing about this particular story is all of us have life that happens to us. COVID is life happening to us. It's not what we want. It's not what we would choose, but these kind of things happen to us. And she had life happen to her. And so she didn't stick with it. And you can see her hemoglobin A1C climb back up to 10. So she was starting to lose control again. But in our practice, we have a great support network. We have something that we call our connectivity index and our connectivity council. We have ways that we reach out to patients in a lot of, you know, we have coaches and occupational therapists and dietitians who help us work with patients. So this patient's still a patient with ours. The latest hemoglobin A1C was 8.7, so we didn't get it quite back down to the 6 yet. But at least we're able to show that we can continue on with this. And I'm looking forward to her next hemoglobin A1C. Some of her, quotes, life happening things are actually better now. And so she's even on a better program, and I bet her next one will be even better. So those are 2 stories. And hopefully what they do is inspire you that this is a very real thing you can do. If you have diabetes, you can actually put it into remission. If you have chronic diseases, the idea of reversing them is not a crazy idea. It's actually a doable idea if you apply things like the 4 lifestyle medicine pillars, things like the Brand New Day programs, and other resources that are available. So I'm going to stop talking there, and I'm going to turn this back over to Jay, and I'll let him go through questions, and we'll answer questions as they come in. So again, anybody who has questions, you can please just put them in the question and answer box, and we'll go from there.
Great presentation. We do have a number of questions that have come in. I did want to just make a couple of quick comments. You know, some of the things that Brand New Day does in support of the pillars that Dr. Dysinger has described is that Brand New Day and our Embrace program, which is a benefit package that is called a CSNP, or Chronic Illness Special Needs Program, covers things like nutrition. We provide free access to gyms, and obviously today with COVID, going to the gym is not a good thing to do at this point. I've heard bars and barbells are not the best thing at this point. But they do have home programs to help people stay active and exercise. Programs for helping people with resilience and improving their sleep. In fact, our last webinar that we did with Lifestyle Medical, and Dr. Pandit, one of Dr. Dysinger's associates, was on how to sleep like a baby again. And if you haven't seen it, it can be watched by video on our Facebook page and perhaps Lifestyle Medical's Facebook page. And then last but not least, connectedness is we also recognize that that is an important aspect to maintaining health. And we offer our members access to a program that we call Wider Circle, which is a socialization program. And for individuals that perhaps don't have quite the social circle of others, it's a way to meet other individuals in your community and get to meet new friends. And in fact, we've even gone as far as turned it into kind of a virtual program like we are doing today, so that people can connect. But now let's move to some questions, some really good questions. And Dr. Dysinger, I'd like to start with, we heard your conversation with us about the importance of diet and exercise. And from a diet perspective, a focus on plant-based diets. But what about some of the diets that are out there that are being promoted, like the paleo or keto or other low-carb types of diets? Are those something that would be beneficial to individuals who are looking to not only reduce or maintain their weight, but also look to put their diabetes in remission?
So that's a great question, and one that a lot of people are thinking about. A lot of doctors are thinking about that kind of thing right now. You know, the first thing I'll say is there's, when we say a word like paleo diet or keto diet or even plant-based diet, those kind of things will vary a lot from person to person and how they apply that. So there are versions of those that are much healthier and versions of them that are less healthy. But the specific answer to that question is it depends on how you're applying it. So we talked about the enemies being the processed sugars and flours. Generally, paleo diets and keto diets are very good at getting processed sugars and processed flours out of people's food supply. But we also talked about the third enemy, being processed fats, also being very, very important. And generally, paleo and especially keto diets aren't that good at taking processed fats out of people's diet. Now there are some versions of those diets where the processed fat is not there much either. So your fat is from avocados or from nuts or maybe from a healthier healthier animal-based source like some fish. And in some of those scenarios, the keto diet or the paleo diet will work well. I never prescribe either the keto diet or the paleo diet because I'm just concerned about those fats, and I feel like a lower fat diet is really where I want my patients to be as far as reversing diabetes or putting diabetes into remission. I really want that to be part of their program, and obviously, especially a keto diet, you're specifically trying to up your fats. So I'm not against paleo and keto diets, and I have had patients who've done well on them. But I do worry about that fat component, and I prefer now the low carb component is generally good, although like I said earlier, there's simple carbs, and that's really the bad ones that you want to stay from, and complex carbs are actually good for you. So when we say low carb, it's a little bit of a misnomer. It's really not the right name. It's a low simple carb diet, not a low carb diet. So that's a great question.
We're actually getting a number of terrific questions that are coming in from our participants, and maybe I can combine a couple of them here together. One of the questions is about alcohol and cheese, and when I think about alcohol and cheese, that tends to be two things that I put together. So maybe a glass of wine and some cheese that goes with it. So from a cheese perspective, a lot of people enjoy having cheese now and then. Are there some that are better than other? And from a standpoint of alcohol, obviously volume counts, but is there something that if someone enjoys to have a glass of wine or a cocktail, is there any recommendations from that perspective?
So yeah, also great questions. So from a cheese perspective, what I talk about with my patients is that cheese is actually a bit addicting. So you actually have cravings for it, and if you try to stop it, you actually will miss it, and will tend to crave it if you eat it at a moderate or higher level. And so what I like to do when I'm trying to reverse or put diabetes in remission, I like to actually eliminate cheese completely. It's just from that addictive perspective, it's just better to stop it completely. But once you get to the point, so like the first patient, his diabetes was gone. Once you get to that point, you can frequently bring back in a little cheese. Now, I don't think that particular patient did. I think he decided he was fine without cheese and he was just sticking with that. But a lot of patients can bring cheese back in to some extent, but I usually recommend starting off that you just eliminate it completely. Now, when you bring it back in, what you want to do is get the cheeses from the deli section more than from that section of the grocery store where there's all these slabs of sort of rubbery white and orange slabs and slices and the cheese that's very processed. Most of that cheese has sugar in it. It has salt in it, and it's really not food. It's really a chemical substance. But that's the kind of, the food companies make it addicting. But if you get it from the deli side, it tends to be a little less processed and a little healthier for you. For alcohol, just real quickly, again, if you're trying to reverse diabetes, probably back away from it completely for a period of time. Once you've gotten your diabetes reversed, you can have small amounts of it here and there. The general guideline for women is no more than 1 drink on average per night. For men, no more than 2 on average per night. I would probably recommend even less than that if you're trying to keep your diabetes in remission. But if you enjoy alcohol, having a little bit here and there is probably fine, but probably not a good idea if you're actively trying to put it in remission. It'll just make it harder to achieve that goal.
Very good. So one of the other questions that is being asked is, we have an individual that indicates that he or she drives a lot for work, even during this COVID-19 period. What do you recommend when I'm on the road? And I'm assuming from a diet perspective.
Yeah, these are great questions. So food that you buy on the road, it's really hard to get healthy food. It's just really hard. It's not impossible. You can go to certain places and get salads and just say, don't put the dressing on it, don't put the cheese on it, don't put the meat on it. Just want a salad. So you can do that. But what I'll say, if I'm in my good place when I'm traveling, whether it's driving locally or going on longer trips, I take my own food with me. So I plan it ahead. I prepare the food. I have my little lunchbox. Even now at work, I pretty much always bring my lunch with me because that way I can control it and I know it's healthy. So it takes a little more time, but it's actually less expensive, and it's certainly the right thing to do from a health perspective. The other thing is that frequently you can go to a grocery store and get better food than you can at, stopping by a fast food place or a restaurant. So if you can go to a grocery store, some of them have salad bars. Others of them you can just buy a little bag of carrots and an apple or something, and get your food that way. So it's tough, and it's not necessarily easy, but you can find ways to travel and be okay.
Wonderful, thank you. So another question has to do with COVID and diabetes, and so with high blood sugar levels, would an individual be predisposed to COVID when positive when tested? Would they have a more likelihood of testing positive than someone else?
Yeah, so another very good question. And what I'll say on that one is that how you get COVID, we're still learning to some extent how you get COVID. I mean, we know that it comes through these respiratory droplets, these little droplets that are floating around in the air. So we know that matters. We also know the dose matters. So if you are exposed to a lot of those, then you're more likely to get it. It's appearing to me, as we're getting more and more data, that there may be a genetic component as well, so that some people are more predisposed to it more so than others. So those factors probably all matter more than how high your blood sugar is. But I'm sure your blood sugar does matter some. I mean, we know that people with high blood sugars get infections more, and COVID-19 is an infection. So I'm sure that it does matter some. But I think the dose and your genes and those kind of things matter even more. Now, once you have the disease, how bad will it be in you? That's where it really matters. So people who don't have the disease tend to have a much better course and are way less likely to die than people who don't have a chronic disease like diabetes.
Thank you. So we have just enough time for a few more questions, but I thought this one it was interesting for our attendees. What we will look to do is to take all of your questions and put them in an FAQ, obviously de-identify them, and they will be followed up with kind of a global email to everyone who attended. So if we don't have time to get to your questions, we will get a response back of some of the common questions that are here and provide you with a response. We have one of the attendees that indicated that they recently had some lab work done, and they were identified as having pre-diabetes, and it created some of the things that you've described in the 4 pillars. So the individual is a little bit anxious about it, and so recommendations for dealing with anxiety, and then does high cholesterol also affect diabetes as well?
Yeah, so I actually answer the first part of that question, or the second part of that question first, which is, yes, there does tend to be connections between high cholesterol and diabetes. There's this thing that we call metabolic syndrome that ties together high blood pressure, diabetes, high cholesterol, overweight, all of those things. So there is a connection. So when you can improve in one, frequently the other ones will improve as well. Now, when anxiety's in the picture, that's a challenge. And I think all of us, I think we wouldn't be true to ourselves if we didn't admit that COVID at least increased our anxiety some. So we're dealing with a anxiety and to some extent depression epidemic right now. And you know, all 4 of those pillars matter in dealing with anxiety and depression too. So exercise helps a lot in those areas. Sleep helps a lot in those areas. What you eat actually does make a difference, even for anxiety and depression. Certainly having connections, so talking about your anxiety with people, literally just verbalizing it, that actually helps decrease it. So all of those things matter. But for us, the place that we go the most for anxiety is actually practicing having quiet times in your mind. Most of us tend to have busy minds. Our society tends to encourage us to have busy minds. And so we're not very good at having a quiet mind. And so we recommend practicing that. And the classic term for practicing a quiet mind is meditation. So in our practice, we actually have meditation classes and other resources to help people grow in their ability to meditate. A lot of people say, well, I can't meditate. My mind's too busy. And most of us, meditation isn't easy. But if you practice it, you get better at it. It's like anything. If you practice it, you get better at it. And so that's where we go first. We don't like to go to medications, but there are medications that matter. There's, like I said, foods that matter. So that's how we think about anxiety in our practice.
Wonderful. Well, I think that what we will do is we'll move on to the summary of the talk today, Dr. Dysinger, and I'll let you go to your next slide, and we'll begin to wrap up. And again, just as a reminder, if we didn't get to your questions, we will get you, everyone on the call, kind of a little FAQ, and hopefully answer everyone's questions today.
So we have two summary slides here. I'll go over this one. I'll let Jay go over the next one, and then we'll be done. So this summary slide basically says, diabetes, it's an epidemic right now. So if you look at that graph that we saw at the very beginning, if you think back in 6 decades or so ago, how it was 1%, and now we're at close to 50% of the population that has either diabetes or pre-diabetes. It's a big problem. And the second point here is that it's a foodborne illness. How we eat, we know that we're eating more fat, we're eating more sugar, we're eating more flour. And that's why we have this diabetes epidemic. So that's what causes it. And we know we can reverse it, put it into remission by sort of reversing those things that we're eating too much of. And that actually matters a lot as far as COVID. So we encourage people to not only think of reversing or putting their diabetes into remission because that's the right thing to do just from the diabetes perspective, but also to protect your health from COVID and other forms of illnesses that diabetes makes worse.
So, as we've heard today from Dr. Dysinger, diabetes type 2 can go into remission. And the 4 lifestyle medicine pillars are available to help you put chronic disease into remission. As we mentioned before, Brand New Day is a Medicare Advantage health plan. We serve a little more than 50,000 members here in California. And we offer some terrific benefits and access to wonderful physicians like Dr. Dysinger that support the pillars that Dr. Dysinger has described in his presentation. And we invite you to learn more about our program and get a benefit review. We also, if you're not already a patient of Dr. Dysinger and Lifestyle Medical, we do recommend that you reach out to them to learn more about Dr. Dysinger and his associates in their practice. They really offer a wonderful program and service to the community, and we know that you will be satisfied with the support that you'll receive from them. And again, Brand New Day, we're a local-based health plan, and Debbie Schumacher is our local representative, and her contact information is there. We thank you again for your participation in attending our webinar. You will see that we will be sending out more invitations for other medical conditions and advice and recommendations on how to maintain and improve your health. And again, we thank you for your attendance and hope you enjoyed our presentation today. Thank you, Dr. Dysinger.
Thank you.